conditions respond to this. But the literature showed that patients with cancer can show good response to these devices, patient with back pain, patient with leg pain, patient with neck pain, patient with also, again, patient with scar pain from surgical operations, which did not resolve after healing of the scars. They all show response to these devices, the intrathecal pumps. But as I said, again, you need to select your patient. You need to discuss these devices. These devices, as I said, the spinal cord stimulator or the intrathecal device, you need to select your patient. Your patient should understand what they have is a chronic pain.
Do you think that still there is a fear among the patients coming to you regarding having devices implanted at the back or in a certain part of their body, or still it is something they are willing to go for? You know, there is a big fear here in Kuwait or anywhere to have a needle or something inserted at the back of the body or in the lower back.
I think it's our duty, and that's what we've been doing for the last 2 years. Increase the awareness of the public, increase the awareness of the people that we do have a pain specialist. We do have some help for these people. We have different methods of treating these patients, as we said. And there's advanced technology to help them. And they should go and seek medical advice, yes, and ask for a referral to a pain specialist. Of course, our colleague is doing this nowadays, and I think we are getting referrals from all over Kuwait.
Do you adjust, is there a trial of inserting this device and checking it prior to discharging the patient with that amount in that container?
Yes, both for the spinal cord stimulator and for the intrathecal device, there is a trial period. These patients, I mean, at the beginning we try the medications, we try other devices, which is much more simple. But then after that, these patients go to the hospital and they have a trial insertion. And it is a trial insertion lasts between 2 weeks and 4 weeks. And we actually send these patients. What we do, we insert the catheter, we insert the leads, but we connect it to an external programmer. Instead of inserting it under the skin, we insert it outside.
So this is the trial period?
Yes, and we send them home because we want to see them satisfied with this machine while doing normal daily activities.
Do they tolerate it or not?
There's no point of putting it and let them be in bed in the hospital. And they usually come to you and say, yes, it's making a lot of difference. And we judge these devices by 3 methods. The first method is we see how much their pain is being controlled. If they tell us my pain is well controlled, more than 50% from pre-implanting of the device, then this is a good result. And if they tell us that now we are stopping our medication or reducing the amount of medication, then this is another thing.
Yes.
The other thing is what we are concerned about, and I think this is the main aim of treating patients with chronic pain, is improving the quality of life.
Yeah, sure.
And get them back to work. Because we know now there is 1.5 million wasted working days is due to chronic pain patients. And 40–70% of patients is due to back pain. And this is the bulk of our
Yes, and we are talking about those who are still in the labor work or still working. But not only this, you know, Dr. Asmahan, we as a country are going high with the geriatric group in the number, and we are going to the picture which is similar in European and also in the North America and Canada countries, where the geriatric population is growing. Yeah. And of course, you know, there's a high incidence of morbidity and mortality. And many of them are immobile because of the pain, as you've mentioned, severe osteoarthritis or crippled hip or a knee joint because of the pain. So this is a big advance and a big help for them to preserve some of the mobility, and by this you will cut a lot of the morbidity and the mortality that accompanies such aging process.
That's exactly what we're looking for,
yes, yes.
It's the quality of life. It's the ability to, I mean, chronic pain has a devastating effect on individuals. From social point of view and from work point of view, most of the people who suffers from chronic pain for years, some patient comes to me suffering from chronic pain for 20 years, severe back pain that they are housebound, they are in the bed all the time, they are taking medications in high doses, and they are sleepy all the time. and they lost their job, they lost their family, and they lost their identity as a human.
Yes.
And that's what we are trying to avoid. If we can get them back into life, social life and working life, and I think that's what we are aiming at.
Now, a lot of the viewers may ask or have that question in their mind. What is really the substance that is there in the pump itself or in the device? And is there a risk of having the dependence of these drugs? Because you've mentioned these are some kind of opioid or something which somebody may think, am I going to be dependent on such drug? Would you like to clarify this point?
I'd like to answer the second half of the question first. Actually, a lot of people have this fear. And not only, I think it's a misunderstanding or misknowledge that a lot of people think if you are on opioid, and I hear it from a lot of patients,
yes.
Such doctor told me they don't
even it's among
get used
doctors,
to it.
Dr. Asman, they
yes,
believe some of
yes,
them.
I agree. I think most people think that if you start somebody on opioid in high doses and on a regular doses, then they tend to be dependent. I disagree, and literature has proved that there is a very, very, very small percentage of patients who can be dependent if they suffer from chronic pain, and if they are taking their medication to treat their chronic pain and they are suffering. People who tend to have a habit of dependent on medications, these are the people who are taking it for recreation. Or for leisure. But a chronic pain patient who takes their medications or opioids, even in high doses, I have patients on morphines, something like 100 or 123 times a day or 4 times a day. So the answer for this question is no.
Yes.
If they are taking it on a regular basis and they are taking it from a prescription from their doctors and pain specialists, and they are well followed up in the clinic, then these patients are not going to have any problem with overdose.
Okay, this is one point clarified. What about when you insert the device now, finishing the trial period, and now it's going to be for a longer time or a longer period? Is there any local complications or side effects from such a process of inserting such a device?
As I said, it's a big commitment from us as a physician and also from the patient. There should be a mutual understanding from the beginning that this is a long-term thing, and their pain is not going to go away one day and they will get rid of this device. This device will stay with them, okay, and it will need follow-up. They might need to reduce their medication and they might stop other medication they are taking, but they should understand that it's a long commitment. This device needs a follow-up. This device the battery can go dead after 9 years or 7 years. This is for the spinal cord stimulator. For the pumps, other technical or device problem, such as leads breakage or leads migrations or catheter blockage, all these problems can happen, and this is why we need to follow these patients up closely.
And how frequently they should come to the clinic to follow up for the device?
It depends, as I said, on the patient condition and also the consumption of the medication itself, and if the presence of any complications. If they use their medication more in high doses, then you need to see them more frequent to refill the devices. They come and we refill their devices in hospital setting with monitoring, and we do it ourselves with our technician with support. And we need to reprogram their pump and the spinal cord stimulator every time we see them, make sure everything is according to our expectation.
Maybe you have a picture, Dr. Asmahan, you would like to... okay, if we have the picture ready, we will show it. Actually, this is something very crucial you have just mentioned, Dr. Asmahan, to clarify, because many patients are in fear of having such devices, even if they were very small, as you mentioned, inserted in their back or at part of their body. So we reassure them regarding the dependence, and we reassure them about local complications. Now, if we say there's a group of people with chronic pain and they are coming to you, are there people who are excluded from having this service or this help? Is there any contraindications or patient with certain problems not appropriate to use this method with them?
Yeah, of course. There is few patients that will not fulfill